Now, going then specifically to review in this case involving decedent Michael Jackson, you found multiple extreme deviations in the standard of care. Is that accurate?
That's correct.
And in your report, you went through noting multiple extreme deviations and then followed that with a specific analysis regarding the care given as it relates to insomnia. Is that right?
That's correct.
I want to begin with the deviations you found prior to getting into insomnia. First, you noted that the setting where Dr. Murray was providing the Propofol was unacceptable and was an egregious violation of the standard of care. Is that accurate?
That's correct.
Please
What I was referring to was using this drug in a setting outside of a highly monitored set unit or a highly monitored facility, meaning intensive care or an operating room or a surgical center with very strict monitoring capabilities. It really, to someone in my field, to really even conceive of using this drug, a deep sedative, in any place outside those that I mentioned is really inconceivable.
Inconceivable?
Right.
In this case, you comment on the need for Dr. Murray to have needed to have additional bedside assistance, and the lack of it was an extreme violation.
I think in this scenario, clearly it would have been helpful and would have provided that additional support. Somebody that was providing the anesthesia, providing the sedation, and somebody that was actually able to monitor. So it allows you to really be able to not do two things at once, to really be able to pay complete and utter full attention to our patients. I think,
and of course, it's absolutely essential if you're going to be a doctor that's going to leave the patient and leave the room, correct?
That's obviously without saying. That is clear. That is really the really fundamental basics of the Hippocratic Oath, or kind of the ethics and morals that physicians swear by. Is first rule is to do what's right for your patient, not to abandon your patient. Absolutely.
Not to what?
Abandon your patient. It's imperative to have an infusion pump, which allows you to really precisely know how much of the sedative you're giving.
And doctor, you concluded in your analysis of the care Dr. Murray gave to Michael Jackson that the lack of this equipment, including the cardiac monitor, the blood pressure cuff, pulse oximetry with an alarm, suction, the crash cart, the airway equipment, the lack of all that equipment and the skills to use it represented, again, another extreme departure from the standard of care?
That's correct.
And when you're using these extreme departures in your vocabulary, in your analysis, does that equate to gross negligence on the part of the doctor?
Correct. I think once you kind of violate the standard of care, these terms you use, really the way I look at it as someone that's not in the legal world, is how far you go from that standard of care, the degree of which you deviate. And certainly extreme is when this is just something that we just would never expect to see in a similar circumstance being practiced by some prudent physician in a reasonable, in a similar circumstance.
And have you ever seen, in your personal experience, a doctor administering Propofol to someone at home in the setting we've been describing?
No, this was the first time I've heard of that.
And when you conclude, as you have on these and as we go forward, that it's an extreme departure, you're concluding that you would never expect to see that from a reasonable, prudent doctor.
That's correct.